Another question, doctor, regarding because of the success in intervention, we definitely know the survival of the patient has increased significantly in India.
The longevity.
Longevity. And there are a lot of questions now arising, but what we call as a heart failure. So what is this heart failure? What is it about heart failure? And how do you think that India should tackle this heart failure population?
Yes, heart failure in terms of most Western worlds, now patients who may get optimum therapy. In heart failure, optimizing an option to the patient is going to be the key. There will be patients who are best candidates for bypass surgery. There will be patients who are best candidates for stent. But there will be patients who are best candidates for ECP. Heart failure class 4, which is the final class where a patient gets bedridden and the only option offered to that unfortunate patient is a heart transplant. Unfortunately, although the surgeons in India are very well qualified and trained to perform heart transplant, but it is still not reached a point where it can become an offering to every hospital, simply because of the very high cost of heart transplantation. Traffic issues in heart transplantation. There are only 5.5 hours available from a vehicular accident to delivery of a heart, which is called the ischemic period of transplantation. If you deliver a heart more than 5.5 hours, the operation is a failure before even you start the operation. So those are the technical modalities of transplant. One of the other technologies that I am the brand ambassador to India is an mechanical artificial heart. A mechanical artificial heart is a device that overrides the failing function of the left ventricle and it takes over that role and it bypasses the left ventricle and it pumps blood to the rest of the bodies, and now patient can have a good quality of life and things. But there is a downside to it. India is still not a country that can afford a device that would cost 100,000 US dollars. Less than 0.5% of Indian population can afford that. What will you do to the remaining 99%? Again, I come back to my discussion about ECP and angiogenesis. These are patients who now have a new option for no option. Initially, they were no option patients. Offer them this new option and they will get, if not the same benefit of a transplant or an artificial heart, but at least they will have easily good qualitative improvement in their life.